Can you reverse degenerative disc disease? When I consult with patients regarding their spine, and especially if they have had MRIs before or x-rays, a lot of times they'll come in my office and they'll say, well, doc, I have degenerative disc disease. And a lot of times when I talk to them about what really degenerative disc disease is, they're kind of shocked because a lot of the times they think they have a disease. It's something they've caught and it's like a systemic disease and it's like they have to resolve it. Like basically as a result of trying to do something to try to like take some medication to try to prevent the disease from happening or occurring. And the problem is degenerative disc disease is not even a disease. It's not something that you catch, not something that you transmit. It's not something that's systemically affecting your entire body. We do know degenerative disc disease is something that affects the discs, and it's the disc degenerating is what we really need to know. And what are discs? And so discs are the material or the cushioning between every set of vertebra. And these discs allow spacing to occur for the vertebra, so it allows the nerves to come out in between every single bone. And these discs primarily help facilitate spinal flexibility. Unlike any other long bone of your body, if you look at the spine being as one bone continuous from your pelvis to your skull, it has to account for movement, and the movement is what allows your body to bend and flex and move forward in your trunk. Well, most of the spinal flexibility, when it comes to spinal flexibility, the number one limiting factor is how flexible or healthy your discs are. If your discs aren't super healthy or super flexible, they limit spinal motion because the discs aren't moving properly. These discs also act like shock absorbers, meaning they allow the forces to be distributed evenly along the discs and allow the spine to distribute mechanical stresses throughout the body. This is also happening as a result of the shape of the spine. So with the discs and the shape of the spine, meaning having a normal lordosis and kyphosis and lordosis in your neck, mid-back, and low back respectively, and the discs themselves, this allows the body to adapt with stress and compression. Now, what is degenerative disc disease and how does this happen? Well, degenerative disc disease is really has to do with alignment, meaning as the spine loses its normal alignment because either of injury, scoliosis, shifting, something happening, this lack of alignment and gravity over time causes the spine in that area to degenerate faster. Now, a lot of times this may be related with age, meaning as older patients, they have more time for the spine to react due to gravitational forces, so they're more likely to have degenerative disc disease in those areas. If it truly was a disc disease issue and it was a disease affecting your entire body, every disc will look exactly the same, and we never see that. It's always very located or to one area of the spine, one or two areas that are adjacent, because that's where the misalignment is. So if you think of degenerative disc disease like an unaligned car, when a car is no longer aligned properly, we know one tire will wear out faster or age faster than the other three. Nothing's really wrong with the tire. Like there's not a disease of the tire. That car doesn't have tire disease. It's basically because the weight of the car is more on one tire than the other, so this one goes through a faster phase of degeneration or wearing out. The same thing is true when it comes to your spine. When your spine is not in the normal alignment, that area that's affected as a result of the misalignment will go through a faster phase of degeneration, and this is what they call degenerative disc disease. The correct term should be you have misalignment of the spine, therefore it's causing the discs and tissues of that area to degenerate quicker. So therefore, the problem isn't really the disc. The disc is a symptom as a result of the misalignment. And this is normally a cumulative effect of abnormal alignment, and it could be this abnormal alignment can happen from repetitive processes like not carrying weights wrong. It could be from sedentary lifestyle, it could be from chronic poor posture, which is again an alignment issue, incorrectly lifting objects, again an alignment issue, constant bad sitting position, which can be an alignment. It's all alignment related. It has nothing to do with the disease spreading throughout your body. Okay. The symptoms of degenerative disc disease are typically flexibility. The number one sign that your discs are deteriorating is that you're losing flexibility in that area. Most commonly, it tends to be the low back, but it can be the mid back, it can be the neck. And once the discs start deteriorating, the flexibility of that area tends to decrease. As the problem starts to continue to affect the flexibility of the area, it tends to lead to back pain or pain in that area, because if the area isn't moving well, the nutrients through that area are not properly circulating, so it tends to start to hurt. Once it starts to hurt, then you start getting prone to other issues like radicular problems, meaning pains radiating, because now it's affecting the nerves down into your, up into your neck, your head, your arms, your legs, things like sciatica. It can be things like thoracic. It can be things like thoracic outlet syndrome, or things that exit into the body or exit out into the extremities, because now you start affecting the nerves and the tissues. Now, if you have degenerative disc disease, can you help it? Well, first thing you want to do is you want to restore normal alignment, because if you don't restore normal alignment, these discs will continue to degenerate. So you want to try to reduce the misalignment. Again, if you have an underlying car, yeah, you want to change the tire, but if you don't restore normal alignment, the tire is just going to degenerate again. So first thing, you have to realign the car. First thing to do is try to realign the spine. So if you have any kind of scoliosis or misalignment, you want to try to straighten out whatever that's happening there. Secondarily is that you want to try to allow the discs to have the best ability to heal on themselves. Now, unfortunately, spinal discs, once you're fully mature, don't have blood supply, meaning in a child, discs have blood supply, meaning the blood vessels are going in and out to the disc, so discs can heal relatively well at this time. However, but once spinal discs no longer have blood supply as you become an adult, they don't heal as well. So once they become deteriorated and degenerated, they're very difficult to see regeneration of discs. So therefore, being proactive towards treatment is by far the most important thing, meaning addressing the cause, which is the symmetry of the spine, so you don't develop any further degeneration. The more alignment that you have in the spine, the more room you have for all the tissues and nerves to exit, so the less likely you are to develop symptoms. If you have degenerated discs, you can improve the flexibility by addressing the cause. Meaning if you improve the alignment, you can improve the flexibility of the discs. If you improve the flexibility of the discs, you can add motion back to the spine. If you add motion back to the spine, you can stop all the effects that are happening as a result of the degenerated disc, even though you can't maybe restore full disc height back. Got it? So you can deal with the flexibility component, which is the number one symptom that happens as a result of degenerated discs. So being proactive and addressing the cause is by far the most important thing. Not just treating the symptoms of the degenerative disc, but actually treating what's causing it, which is normally alignment. Here at Scoliosis Reduction Center, we actually work towards preserving disc function because we want to try to restore normal alignment. If you can restore more alignment, like I said, you prevent further damage and allow the flexibility of the disc to remain, or reverse some of that flexibility to allow the body to heal like it was meant to. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.